Hello, my name is Jessica Hernandez and I'm going to be demonstrating blood pressure according to the ACSM guidelines. Prior to taking blood pressure, you should ensure that your client has been seated for the past 5 minutes and their arms are in an elevated position or at heart level. It is important that your client's feet are planted on the ground and their back is supported. 30 minutes prior to taking blood pressure, you should ensure that your client has not ingested caffeine or nicotine. Lastly, your client should have removed all garments or other tight clothing, leaving a bare arm. Next, you want to wrap the appropriate size cuff around the upper arm and align the cuff with the brachial artery. The cuff should circle at least 80% of the upper arm. When using the stethoscope, you must ensure that the prongs are facing forward and that the hearing is on by twisting the stem. Now we place the stethoscope bell below the antecubical space over the brachial artery. Quickly inflate the cuff pressure to about 200 millimeters of mercury. Then slowly release the pressure at a rate equal to 2 to 5 millimeters of mercury per second. You are then going to hear about 5 sounds known as the Korthoff sounds. The first sound is known as the subject's systolic blood pressure, and the final sound is known as the diastolic blood pressure. Normal blood pressure includes a systolic blood pressure of 120 millimeters of mercury and a diastolic blood pressure of 80 millimeters of mercury. Any levels higher than this indicates that there is prehypertension or hypertension blood pressure. Prehypertension blood pressure includes a systolic blood pressure of 140 to 159 millimeters of mercury and a diastolic blood pressure of 90 to 99 millimeters of mercury. Hypertensive blood pressure includes a systolic blood pressure of 160 millimeters of mercury and a diastolic blood pressure of 100 millimeters of mercury.